Ligia Ricciardi. I'm the Chief Transformation Officer with Carium, and I'm here at the Digital Health Live Studio at CES 2020. I'm joined by two guests today who are both with Automation Anywhere. We have Catherine Calarco, who's the Senior Director of Global Industry Strategy and Life Sciences.
Thank you.
And Neeti Shukla, who is the co-founder and Senior VP. Welcome to both of you.
Thanks for having us.
Thank you, it's great to be here.
So to start off, what does Automation Anywhere do?
Automation Anywhere is the leading and the world's largest provider of digital workforce. And by that we mean software bots, who you can train as humans to do certain repetitive and mundane processes that we have at work across all industries, across all verticals. And the idea behind it is that humans have to be enabled with these bots or digital workers in order to free them from the repetitive and mundane work that we do, especially regarding a lot of data and processes that are repetitive or administrative in nature. And if we can get rid of it, we believe that humans can then focus on the knowledge work, on the creative work, on the innovative work. And the idea is to free them from this repetitive and mundane so that we can go and be great.
That makes a lot of sense. So what does the term RPA refer to?
RPA is robotic process automation, and by that it simply means automation that has been really democratized, easy to use, and can be used across parts of processes or end-to-end processing across any application. Across any legacy application, any of the technology stack that we currently use, or anything that will be created in the future. And sorry.
Yeah, no, sorry to jump in. I was just wondering if we could have a concrete example, maybe from life sciences, of what kind of thing you're talking about.
Absolutely.
Yeah, so the essence here is strategically the life sciences industry is facing a tremendous amount of challenges, right? Everything from pricing, margins, to innovations, to having to improve patient engagement and create better outcomes. And at the same time, they're struggling with existing levers that actually can move the dial for them. Mm-hmm. So the leading life sciences companies are now deploying automation. And they're creating digital workers to help move their workers from out of manual tasks into higher value. And 85% of the top leading life sciences companies have deployed automation. And what's great about it is it's doing things like taking them out of having to do spreadsheets, so they're creating reports. So one example of this medical device company has actually automated their complaint handling. So non-reportable complaints like, the sensor doesn't work, or I couldn't open the bottle. And so they have to do it by a completely compliant process as if it was reported to the FDA. So now what they can do is they can use a digital worker to do that for them. So the digital worker does the work that a person would do. It's completely auditable, so it's within their compliance. Mm-hmm. It's trackable, it does exactly the same steps and follows the business rules associated with how to handle that complaint. And it can access multiple systems. So you could go into your complaint queue, look at that, and then go into your databases or SharePoint or other access points, pull all that information together and actually file that complaint. So this is one of the key stories around this is at Amgen, one of their team noticed that their scientists were going in and out of a clean room where the lab was, and they said, and they have to take their gear off, and they walk out, and then they get some data out of a machine that's outside of the lab. So they're like, wait, this is a really bad use of their time.
Right.
And this was 20 minutes to 2 hours a day doing this.
Wow.
So one of the workers, and this is about the democratization of the ability to do intelligent automation, is one of the teams saw this, heard about RPA, said, I think I can build a bot, learned how to do it, decided to use Google Home to access the data from the machine outside the clean room, and was able to save 20 minutes to 2 hours a day. And this is cancer research. This is where you want to move research and science faster. And if you do that, you get 10x more return in that lab. So this is an area where you see value. And so we're seeing companies across their business deploy hundreds of bots and digital workers to do this type of work to make science move faster and us to get better healthcare.
That's really exciting. One final question. How far along are we on this? Is this sort of at the very beginning of use of these types of technologies, or is it pretty well established?
It is becoming very mature. We're seeing life science companies, a leading company, 85% use it now across the world, and they have been using it for multiple years. It's become a standard operational, a way of operating. It's new to some, they're like, what is this? How do I use this? But in fact, the Everest report just did a study that was released recently on intelligent automation in life sciences, showing that it's adopted across the value chain, and it's growing at 60 to 70% per year next year.
Wow.
Yeah,
and that's
so
true
it's
across all industries and all verticals. We see wide-scale adoption because, again, it's the same concept, in every industry. They should be focusing on the customer or the patient or the hospital or their end customer, whoever they might be, and not on the repetitive tasks that are there today.
Well, that is very exciting. Thank you so much, both Neeti and Catherine, for sharing. And thank you for joining us here at the Digital Health Live studio at CES 2020.
Thank you
so much.